So as a quick introduction, I'm Dr. Roy Sugarman. I'm a clinical neuropsychologist, a clinical psychologist, and an expert in peak performance. I'm going to be making a few remarks today on mindfulness and the practice of mindfulness and how it impacts on the neurology of the brain, and give you some insights as to what we found across the world when it comes to the practice of mindfulness and its value for your everyday life. Yeah, so to answer the question, what mindfulness is, it's a mental state that we use in psychotherapy where you focus on your awareness of the present moment, you stay in the present moment, but at the same time you accept that there's a lot of other stuff going on which you just accept. So your bodily sensations, your emotions, your anxieties, you just accept them while watching them. So in essence you become the watcher, just looking at the present state. Now, anxiety is kind of the fear of the unknown, and it's the fear of the unpredictable. So by just staying in the moment and not thinking about the future, not thinking about the past, then we tend to get a sense of, well, I'm in the moment, and all I have to deal with is the moment, and you can bring yourself into a nice, calm state. So that's what mindfulness is. Now, there are a lot of different ways to achieve that in different practices, from cupboard Zen to a whole range of others, but that's the basics. Well, if you think about one of these mechanisms we're talking about is the lowering of oxidative stress. In other words, the lowering of the damage that free radicals and stresses will do in the body and the brain. And also lowering inflammation by, let's say, dropping the inflammatory cytokines and C-reactive protein measures. They seem to come down with the practice of mindfulness. And not only that, these effects seem to take place even within the first 8 weeks of beginning the practice of mindfulness or mindfulness meditation, which is really cool. So there are a lot of these mechanisms which overall are going to help you overcome the effects, for instance, of sitting. Sitting is going to build up oxidative stress, it's going to change your lipid profile, it's going to change your resistance to insulin and so on. And it seems that mindfulness meditation appears to undo a lot of that and helps you then prevent the stresses and aging and overall dangers to your body and brain. So if you think of body and brain as a single entity, it appears that health in the one is health in the other, and that meditation, and especially mindfulness, keeps you a lot healthier and prevents a lot of the effects of the daily life and stresses and aging stresses, which are the things we need to fight. And obviously it's not a magic pill, so you still need to exercise, you still need to watch your diet, but adding mindfulness to that is the third component which we talk about so much, in terms of that if every day is going to be a strain on your body, you want to feel for it, you want to train for it, you want to keep on moving and do stuff.